Hi, everyone. This is Deborah Moore from SCNM. Can you hear me okay?
Yep.
Excellent. Hi, Dr. Salisbury. So nice to have you give this, this presentation today. I've been excited to hear about it, and I know so many of our prospective students are. We won't get started for another minute or so. Let everybody join us, including Sarah. My colleague Sarah Guman will also be joining us today. But thank you again for being here for this.
Yeah, of course.
There's Sarah. Hi, Sarah.
Hi, everyone.
Hi.
Well, it looks like it's 2 p.m. right on the dot, so I'm going to go ahead and get started. Others may join us as we continue on here. But first of all, I want to thank everyone for coming to our Discovery virtual chat today. Sarah and I do these about twice a month, but this is the first time we've had Dr. Salisbury on and to do a presentation on her journey into naturopathic medicine, as well as to talk about her current position with our community clinics, which are so exciting, and to talk about maybe the options that prospective students can look into as they become naturopathic students and perhaps do some clinical rotations in our community clinics. So what I'll start off with is just a short introduction of myself, and then Sarah will introduce herself. And then Dr. Salisbury, if you're ready, after Sarah, you can just take it away.
Sounds good.
Okay, excellent. Well, my name's Deborah Moore, and I'm an admissions representative along with Sarah. I've been with SCNM for about 10 years and very excited to meet each of you today. And if you have questions, answer those as well.
Great, and welcome everyone. I'm Sarah, so I work alongside Deb in admissions. I've been with SCNM for almost 9 years now, so it really is a wonderful organization, and we're excited to tell you more about it.
Sorry, when the button just doesn't unclick when you need it too fast enough. And I'm Dr. Salisbury. So I'll just give you a little bit of a background on myself. So I'm originally from Houston, Texas, moved to Arizona in 2012 to start the program. I was brought to naturopathic medicine, as are a number of students, because I sought a different sort of healthcare than what I was getting from my own health concerns. I found a naturopath in Houston who graduated from SCNM, and I had really good results in kind of turning around some of my health concerns. And it really made me excited to share it with other patients. I knew that that was something that I wanted to do. I have a background in public health, so I worked for the City of Houston Health Department before coming to school. And then before that, I worked at another nonprofit. I also have a master's in nonprofit management, and I finished my master's in acupuncture a couple years ago. I graduated from SCNM in 2016. After graduation, I actually did 3 years of general medicine residency at the SCNM Medical Center. In the last year, I was a chief resident, so I was in charge of managing a number of residents as well as running my own student rotations in the medical center. After I finished that in 2019, I went on to become adjunct faculty. So I was teaching some of the first year courses, and then another course where students can work on clinical skills. And I apologize, my child is screaming in the background. Where I would help students work on clinical skills that are third and fourth year students, and had 2 rotations in our medical center. So I did that from 2019 until probably almost a month ago. And so I've been working with the school for a number of years. So that's kind of my journey to where I am now. In the medical center, I would see a number of different conditions. I saw a lot of everything. Some people will give you the advice that you need to niche your practices. I consider myself to just be more primary care. So I saw everything from anxiety, depression, fibroids, endometriosis, PCOS, IBS, a number of GI issues, so many different things. I really enjoyed it. And I also would get a number of very complicated patients. And so students tend to really enjoy that as well, because you get to kind of really try to find the root cause of what's going on with them. So they really enjoyed my rotations. In my new role as the Roosevelt Health Clinic Director, I still have student rotations. So I do oversee 2 rotations right now, as well as doing a little bit of teaching still, but that will change relatively soon. And then I have a couple of other physicians that work at the clinic with me, that have general medicine rotations. And then there is one that is focused on regenerative injections. So Roosevelt Health Clinic, we see a number of patients who don't have access to healthcare. So we act as primary care for a number of them. It is a free clinic. So we serve, the underinsured or the uninsured mostly. We act as primary care physicians there. We manage a number of health concerns. A lot of our patients have type 2 diabetes, hypertension, a lot of gynecological issues. We manage all of that for them. So we kind of blend everything. We have a number of patients that we might manage their medication, but we're also making lifestyle changes, and they're getting supplements and things like that. All of the supplements that we have are donated from different organizations or partners that recognize the need for our kind of medicine in the community. So we see a number of patients like that. We have a number who have a lot of pain as well. So we do a lot of acupuncture there. So we do a ton of acupuncture. Everything is a free service for them. And it is a mostly Spanish speaking clinic. It is in South Phoenix, if you're familiar with the Phoenix area. So most of our patients do speak Spanish. And we are incredibly busy. We see on average, probably most rotations see about 15 patients in a 4-hour period, which is a lot for naturopaths. So we see a lot of patients there. And that's just one of our community clinics. That's probably the largest one because we have rotations there daily. Another one of our clinics is, we have them throughout. So I'll talk about all of them. So we also have Changing Lives. It's a we have a little clinic there. So Changing Lives is a rehab, inpatient rehab facility for women. And so there we kind of are more adjunct. We just kind of, treat them more for a lot of pain, because a lot of the women there are, they are potentially detoxing. They're in rehab. And so the things that they use to manage their pain before, they're no longer using. So the drugs that they're using. And so they're having a lot of, breakthrough pain. And so we manage quite a bit of that. We do a lot of acupuncture there, lifestyle changes that we can, things like that. So we have rotations there for students. We're also at Sojourners domestic abuse shelter. So we have students there that can help the women and their children with any kind of need that they have. When I was a student, I rotated through all these places. Roosevelt wasn't there just yet because I graduated so long ago. But the other places I've been there as a student, and I loved my time there. And so Sojo, you treat a number of different things. We have supplements both at Changing Lives and Sojourners that are donated as well. Everything is based on donation, and then everything in our community clinics is free. But we're on site for Changing Lives and for Sojourners. We also have Hamilton School, elementary school, where we have a little clinic. So we see patients in that community. It is a large Spanish speaking community as well, where that clinic is located. We treat a lot of chronic conditions there as well, kind of like Roosevelt. And we manage medications. We can, make lifestyle changes, botanicals. We do a number of things at that clinic too, comparable to the other ones. And you have a chance when you're in clinic to rotate through all of these places. And then the last one that we're waiting to reopen is the Southwest HIV Center. When I was a student, we had rotations there, and it was probably one of the most fulfilling places that I was at, just because the patients tend to be on a large number of medications. And so the things that they can do are so limited, both allopathically and naturopathically, because you don't want to interfere with their medications. So we would do a lot of lifestyle that we could, acupuncture again, just because it was one of the safest things we could do, homeopathy. And you would see the patients improve. And there were actually a couple of patients who would go to all of the graduations because that's how much they appreciated our services. They would just be there and they would be cheering you on when you cross the stage. It was really cool. So we're waiting for them to open up again. But we're going to have the opportunity for students to rotate through that clinic as well. So all of our clinics are, like I mentioned before, are donation based. So they come from our SAGE Foundation, which people will donate to, so that we can operate the clinics and have students rotate through all of them. So that's our community clinics in a nutshell. What I want to know is, what questions do you have based on the 12 minutes of me bombarding you with information? If any.
And I'll just add, audience, prospective students, please feel free to open up your mic. We're a small enough group. You can open up your camera if you choose to. If you prefer not to do that, feel free to type in your questions into the chat, and Sarah will read your questions off to Dr. Salisbury. But Dr. Salisbury, one student emailed me who couldn't attend today, and she had a question, and this is her question. Basically, her focus is public health. That's what she wants to do for a career, loves naturopathic medicine, wants to combine those. her undergrad degree is in public health. She wants to know if doing her clinical rotations through SCNM will provide her that foundation on her resume to then get a job in public health. I know you have a background in public health, but what do you think about that?
I mean, I can't say for sure. What I would say is, I think if she structured it appropriately, she probably would have a good chance, because we do work with a number of vulnerable populations that are underserved, a number of indigenous populations as well. And that kind of tends to be the focus of public health. So I really like the community clinics, because to me, public health is the idea of we affect the whole, and naturopathic medicine is very much the individual. And I personally feel that the community clinics in Roosevelt in particular, it kind of merges them both. And so you can still apply those overall public health ideals to the clinics. And I think that they kind of mirror each other, but you can still affect the individual. So they're getting that individualized care and kind of a public health like clinic. It would depend on the job, I would say, but I think that it's very much a different experience than our medical centers.
Excellent, excellent. I'll let her know, because her question was, should she get their master's in public health first and then become an ND, or would it suffice to go, come straight in to our program? So there's no guarantee she knew that, but thank you for the additional feedback. I don't see any additional questions yet, but there are common questions that Sarah and I both hear. And so I am going to ask this.
I have a question.
Oh, excellent.
Hi, my name is Michael, and I was wondering, and I don't know, you're an academician, so, but you're graduates, okay? Do they, how does it break down in terms of they end up in clinics with other NDs, or do they go solo, or do they join up with medical doctors, or in other words, so I'm just wondering how it breaks down in terms of once patients make it through the program and graduates, where do they typically end up?
So that's a question Sarah and I can answer, Dr. Salisbury, because it's basically, the career opportunities for NDs. And what I'd like to do is, while we have Dr. Salisbury with us, if we could just focus on the topic of community centers and clinical rotations of NDs and that sort of thing. I will answer your question, Michael, because we don't have any questions in the chat yet. That might buy a little bit more time. But basically, the bulk of our graduates choose to start off in a naturopathic medical clinic that's already successful and needs to hire on another ND because their patient load is exploding. And what's great about that is that our new grads end up with a really great opportunity to have patients already set up for them. And typically the starting salary is between $80,000 and $85,000 a year for that particular employment situation. Other students want that integrated model where they're in with NDs and MDs, and Cancer Treatment Centers of America is the second largest employer of NDs. Starting salary is about $90,000 a year. Again, you have built-in patients, so it's a great way to start off. And then often they spin off later, 3 to 5 years later, and they start their own practice. Some of our graduates, they start their own practice day one, and that can be the tougher road to go because, of course, there's no guarantee that you're going to be able to make a great living that first year as you build your practice from scratch. And then some, like Dr. Salisbury, they do residencies, which are not required for NDs, but they don't pay really well, but it is a great way to obviously learn so much more. And Dr. Salisbury, do you want to talk about your residencies a little bit and why you chose to do that route?
So I chose residency because I really just enjoy teaching. And so there are different types of residencies. So there are school-based residencies where the residents are working in the school medical centers. And then there are private residencies where private physicians will say, hey, I, really want this opportunity to help train a new graduate. I'll offer a residency in my clinic, like we're busy enough, I can pay them a salary, things like that. There's a lot of mentoring in our field, and a lot of physicians really feel the need that they need to mentor new doctors. And so they'll kind of take that on, having a residency in their private practices. So there's two different types. I did one in the medical center. And so I really like that teaching component. You won't get that in a private residency because there aren't students that you're working with or anything like that. I wanted to learn more, and I wanted to see more patients faster. So when you're a resident in a medical center associated with the school, you're gonna see a number of patients compared to privately, just because you're on a 4-hour rotation with an attending physician. And, that physician might see, 5 to 8 patients in 4 hours. And then you'll have 5 or 6 rotations that you're assigned. And so you get to work with a number of different doctors. I also chose it because I always wanted to just kind of be, what's the word? I wanted to always have another physician around to kind of bounce an idea off of. So it's very open in our medical center. Like we can walk into another classroom. If we have a patient and we're not sure of what to do with, I can go and ask another doctor. What are their thoughts? Have they seen this before? Am I doing everything correctly? So I'm always able to have another opinion. Versus, maybe privately, and there's nothing wrong with it. Privately, a lot of the times, those private residencies will have a assigned time that you work with them as a resident, and you go through cases one-on-one. Versus, I could literally walk into a classroom and just ask the doctors what they thought. And so, you kind of can just interrupt, and that might be important for you if you have a patient who has a concern that's kind of timely. So I like that portion of it. It's very much a group kind of team dynamic. You are with about 4 or 5 other residents, and you're all kind of going through it at the same time. You're supervising the students, you're performing the physical exams, you're going through the treatment plans with the students. For the patients, you're watching the students deliver the treatment plans, doing the physical exams, responding to the patient communication that's coming through. You do a lot more hands-on things at a higher volume. So I was thinking about it the other day, and I was trying to gauge how many patients I've probably seen in residency, and I would say easily in that first year, easily over 1,000. Whereas my colleagues who maybe went into private practice automatically, there's just no way they physically could have because they're not seeing the same number that I am. Everything is a little different. Like they're seeing a patient one-on-one. It might only be, 4 patients a day versus me seeing 15 to 20 5 days a week. So it's a little bit different. So you get exposed to a lot of pathology. And so you get to see a number of conditions and how you would treat them, interpreting labs, referrals. You see a lot. So it makes you a more competent physician because you can basically treat anything, or you know where to send people to, or what you're comfortable seeing, things like that. So that's kind of the perks of doing residencies.
How long was your residency?
So I had a first-year residency, a second-year residency, and a third-year residency. So you can choose to only have a one-year residency. You can choose to apply for a second year, and then they had openings for a third year, and so I did that.
Great, thank you. So I see we have a few questions in the chat, and just really quick while we're on the topic of residencies, there's a question here. Do residencies have to be completed in the state of Arizona, or are students able to pursue a residency approved by SCNM elsewhere?
So they do not have to be completed in Arizona. If you are interested in residencies, the different schools host different sites. And so when you get closer to that time, I believe there's normally like a residency presentation, and they kind of go through everything, but there are residencies throughout the United States and Canada where you can go and do one, and you can do a private one, or you can work at one of the schools if you want. You just kind of have to see what you're interested in, and then you just apply an interview, and there's a match day and everything just like that. But it does not have to be in Arizona. I don't know. Let me back up, and my brain is going like 1,000 miles a minute. I know that there are a couple of states that do require residencies to practice, or at least I know of one, I believe Utah. They require a residency to practice in their state as an ND, but I believe you can have a residency anywhere. It doesn't matter. It just is a one-year residency, but not just in Arizona, no.
Okay, great. So regarding the community clinics, can you go into more detail about what a student's role would be at each of the clinics?
Yeah, so for the students, so we have primary students that are typically our fourth-year students, so they're about to graduate. And then we have secondary students that are normally our third years who just entered clinic. Right now, I think there's like 4 different classes in clinic, just because we have a class about to graduate in June, one that will graduate in December, and then we have 2 sets of secondaries. So when you're a primary student, you're the student who is doing the intake for the patient. So you're the one asking them all the questions. You're using your clinical thinking to try to figure out what diagnoses they could have, and you're formulating questions around that. You gather all of that information, you perform a physical exam, and then you come back and you report to your doctor. So our rotations have, at Roosevelt, we have about, on average, 10 students per rotation. Sometimes it's split 5 and 5, so 5 primaries, 5 secondaries. Sometimes it's a little bit more, just kind of depends on class scheduling and things like that. But the primary will then report to the doctor and tell them everything that they just gathered from the patient. If the doctor has more questions, then the student will go back in and ask those so we can get more information. As the doctor, we ask the student, what do you think is going on? Like, why are they presenting like this? Like, based on all of these symptoms, what diagnoses do you think they have, and how would we diagnose that? So the student's responsible for saying kind of their clinical thinking of what they think is going on with the patient, labs and things that we would need to run in order to confirm diagnoses. And then the student will come up with a treatment sheet, typically with their secondary or whoever's on the case. And then sometimes, the doctor will help them, but we try to let the students kind of develop that treatment themselves so that they can get feedback on if they're going in the right directions or not in terms of clinical thinking and reasoning and things like that. So we do all of that for every patient. The student will also write their chart note and submit it to us. So my resident reads it, and then I'll read it again to make sure that they're capturing all that information. They also will go back and the student will discuss the treatment with the patient and what we want to do and what our plan of action is. And then we see them again for follow-up to see how they've improved, or if they haven't improved, what we need to change to help them get better. So that's typically what a primary does. A secondary, they're going to be the ones who will prepare the room, so making sure that the primary has everything that they need. They also will take vitals for every patient. They gather all of that information, and then their job is really to observe their primary. They've taken a test to get into clinic to be able to do an intake, but there's a lot of learning that happens in the room just watching the student do the intake and figuring out kind of how they want to interact with patients, because they might be pretty new to clinic and they haven't quite, gotten their feet wet in terms of patient care. So they really try to go with different students and see kind of what they think works best for them and how to relate to the patients. So that's typically what we do in clinic.
Okay, great. And so I see we're coming up on 2:30, and then Dr. Salisbury, you need to leave at 2:30. Is that correct?
Yeah.
Okay, so I don't know if we have time for just one more question, and then
Probably, yeah.
The other questions Deb and I will try to answer. Let's see. I think we can go over that a little bit later. So back to residencies. Do you think being exposed to more patients more quickly via a residency gave you a head start in your career in terms of clinical and critical thinking skills versus other students from your cohort?
Yes, without a doubt, because you're just exposed to so much more. Pathology, just so much more. You're just exposed to everything in residency, especially when you choose to do one that's school-based where you see everything. There's not a doubt in my mind because it's just the volume, like I mentioned earlier, like the volume of patients that you'll see. It makes you think a lot faster clinically than someone who might have to look things up, and there's nothing wrong with that. Everyone has different paths, but I really I thought it really helped build confidence in my ability to see a lot of difficult cases, and so that really did help my clinical thinking.
Great. Well, thank you so much. I know you need to get going, and Deborah and I will stay in the chat to answer a couple more, stay on the call to answer a couple more questions in the chat. And if anybody has any other questions about the admissions process in general. But thank you, Dr. Salisbury, for being here. We really appreciate it.
Yeah, thanks for having me.
Especially having a newborn baby.
Yes.
Oh yeah, he's 6 months tomorrow, so.
Oh my goodness.
That's exciting.
Yes,
amazing.
Thanks. All right, y'all have a good one.
Thank you
Thanks,
so
you too.
much.
Thanks.
Bye-bye.
Bye. So for the rest of you, we'll finish up the questions. Sarah and I can see if we can answer them. If we cannot answer them, we'll have you email the questions to me, and Sarah can put my email address, d.moore@scnm.edu, in the chat. Email them to me, and then I will forward them to Dr. Salisbury. But as you've noticed, she just started this job as the director of the Roosevelt School District Community Clinic, and she has a 6-month-old. So give her some time to get back to you via email. But email your questions to me if we can't answer them. But Sarah, let's go ahead and see how we can do.
Yeah, so I don't think we got to this one. I think Dr. Salisbury addressed some of it, but Deb, if you want to add anything else. So I wanted to know, what is the length of clinical rotations, and how do rotations at the SCNM medical centers differ from those done at the community clinics?
So I'll answer what I do know, but it's not a real direct answer to your question. So I'm going to want you to email that one to me so that we can get a more in-depth answer from Dr. Salisbury. But this is what I do know. Your junior, senior year at SCNM, once you've taken your first medical board exam and you've done your white coat ceremony, you're doing your clinical rotation. If you want to stay on campus, we have 2 medical clinics that you can do them in, the more general medical clinic and then the Neil Reardon Regenerative Medicine Center. And so the rotations, you typically are matched up with a doctor who's doing a particular modality of natural healing that you need to learn. So in the regenerative medical clinic, obviously you'd be matched with like Dr. Bethel or one of the other docs who focuses on the regenerative medicine. For acupuncture, probably Dr. Dang or Dr. Trahan. And so so the answer to your question is, as you're learning the different modalities of natural healing and you're matched to the faculty, your rotations mirror their schedules. This is the way I understand it. Sarah, can you add anything more to that?
Yeah, so that's exactly right. So you, like Dr. Salisbury was mentioning, there's a primary and a secondary student who sees the patient, and sometimes the doctor will come in and address things as well. But yeah, and you know, there's classrooms where you can go back, talk it over with the doctor, talk it over with your classmates, develop a treatment protocol. And so you might have one patient with you for about 2 hours in total, from seeing them, talking to them, addressing the whole picture, to writing up the protocol and remedies and all of that. And you'll see a variety of doctors. You know, you'll be on a variety of different rotations, maybe pediatrics one quarter, women's health another quarter, you know, different ones together. So that's a big part of your 3rd and 4th year in the program, doing those clinic rotations. So, and it's nice we have 2 medical centers right on our campus. So yeah, I hope that answers that. And then I have another question here that we might, I don't know, we'll try to take a go at this. Is there a way to decide which of the 2 types of residency would be more effective for the type of program you want to enter? So for example, private residency for hydrotherapy or classroom-based residency for hydrotherapy. Oh, so like after you graduate, you know, the 2 options would be to apply for a residency at our medical centers on campus, or to apply for a residency at a local ND clinic here in town or in a different state or wherever. So, you know, again, I think it goes back to what Dr. Salisbury was saying and how she was able to see far more patients doing a residency at the medical centers on our campus. But, you know, there's you know, benefits to both of them, and both of them are great experiences. I don't know if you want to add anything, Deb.
Well, that was great, Sarah. What I would add is we have a full-time, we're the only ND program that has a full-time manager of career services, and her name's Debbie Taylor. And Debbie helps each student starting the first day of your freshman year to know what's available to you, to learn about the different types of residencies and all the career options, not just residencies, because remember, a very small percentage of our students choose residencies. Most of them want to go out and practice after 4 years. But for those who want to choose residency, you have an opportunity to meet with the doctors, like some of our alumni offer residencies. For instance, Dr. Leela Turner, she's one of our graduates. She has her own clinic in Phoenix, and she does residencies. Her focus is women's health, so OBGYN, and, you know, the hormone replacement therapy and aesthetics and beauty, all of that is within her particular clinic. And so you get to know all the docs that are offering residencies. They write them out. Debbie helps you to prepare to apply to them by giving you the tips of what is the most successful. So the whole residency process is quite in-depth, and over the full 4 years, you learn more and more and more so that you can start tailoring down what it is you really want to go after. So by the time you're ready to graduate, you are, I think it's a year in advance, you start applying for the residencies you're most interested in. They're very competitive. So you apply for many, not just one.
Good. Well, I think that's all the questions I saw in the chat, but if anybody else has any other questions, just let us know. Again, you can turn on your camera, turn on your mic, or just write the question in the chat.
And I was going to say before we go, if you don't have more questions, if you have not had an opportunity to receive a pre-evaluation of your unofficial transcripts as you're trying to discover whether or not you meet our prerequisites, we do offer this, and you can email them to me at d.moore@scnm.edu, and we'll provide you with feedback about what classes you still need to take, if any, or it might say, congratulations, you've met our academic admissions criteria, you're ready to apply. And so that is a free service that we do offer. We do this every couple of weeks. Sarah, you have one coming up. When's your next one?
So 2 weeks from today, on April 30th, we'll be talking to a current student. So you'll get to ask a current student questions about what it's like to be in the ND program. And Deb, I just put your email address in the chat, so feel free to email her with any other questions, with your transcripts. And right now we are accepting applications for this coming fall, which starts in early October. There's still time to apply for that, as well as next spring, which starts in early April.
Excellent. Well, thank you all again for attending. I hope it was helpful to you, and do send those follow-up email questions, and we'll look forward to seeing you next time. Hope you attend then as well.
Thank you.
You're welcome. Have a good day. Bye-bye.
Thanks so much. Bye-bye.